So it was a rainy day outside, and a gentleman, we have two offices in the building, I might add. So one is a private practice, and one is, of course, a community medical, Clinica Sierra Vista. And patient went to the private practice by accident. So someone brought him to Clinica Sierra Vista, just dropped him and kind of said, hey, you guys can help him at the front counter. So the front office staff, they were like, this guy's there. He's wet. He has a stick in his hand. I don't know really what he needs. So I called him back to my office, and I asked him, what was it that I can do to help him? Well, he explained to me that he was diabetic and that he had cataracts in his eyes, and they were basically, he was blind. And he didn't have any medical insurance. He was homeless. He lived in like I guess like a junkyard, for cars or what have you. So the owner would let him stay there at nighttime, not during the day because they were open. And that's basically, what he did. So I kind of felt bad for him. And the first thing I wanted to do was kind of like get him off the streets. I was worried because he was blind. So I'm just questioning, like, how did you get here? How do you cross the street? How did you not get ran over? So I kind of just wanted to take him home, but I know I couldn't do that. So that day, what I did is I brought him upstairs, and at that time we had another program to help the patients apply for Medi-Cal. So I went ahead and did that. And then I was able to get him a room at a homeless shelter. And then I gave him like bus tokens, because our homeless program provides bus tokens for him to come back like the following day. So I'm like, okay, I'm going to help you. We're going to get through this. We're going to get your eyes taken care of. I didn't really know how, but I'm like, yeah, we're going to do this. So he came back the next day, and he had like mail and all these letters and things like that. And of course he couldn't read them. So I'm like, okay, this, just bring them back to me, and then we'll sit, and then, I'll open them and read them for you. So, during lunch break, and he comes, and he's a really nice guy too. He's like a father of three. I learned divorcee. He used to paint cars, and I guess like the film from the cars, it didn't help, but it irritated his eyes, and that was a part of that too. So but I would read the mail for him, and things like that. And then shortly after, there's a place downtown that takes like elderly disabled people there. So I was able to call there, see if they had space available, have doctor kind of give a referral of why this gentleman need to stay there. But first he had to have some source of income. So then we had to go ahead and apply for Social Security. So it took us maybe a process of 2 months, I want to say. After the 2 months, he had Medi-Cal. He was able to go ahead and have LASIK eye surgery, so he regained his vision. He got a place to stay at the place downtown, and today he's just living in society like everybody else. I am Kizzy Williams, and I am California Health Plus.